Liraglutide effectively controls the progression of diabetic nephropathy. Diabetic kidney disease is one of the most common conditions that affect 1 among every 4 individuals. Most commonly, the individuals who have a history of diabetes or cardiovascular disease are at an increased risk of developing diabetic nephropathy. Diabetes is known to affect the kidneys, wherein the body tends to retain comparatively more amounts of water and salts than it does. The water and salt retention often results in weight gain and ankle swelling. The study determines the efficacy of liraglutide in reducing the risks of kidney disease in patients with type 2 diabetes. The main objective of the study was to evaluate that liraglutide is effective to reduce the risk of renal disease in diabetic patients. The study was a randomized, placebo-controlled study, in which the sample size was 9,340. Patients with type 2 diabetes and cardiovascular diseases were included in the study. Overall, there were 9,340 patients in the study, out of which 4,668 patients were randomly allotted to an experimental group, and 4,672 patients to control group. Approximately 220 patients in stage 4 chronic kidney disease had glomerular filtration rate of 15 to less than 30 milliliters per minute per 1.73 meters square of body surface area. The patients who received the trial regimen had a follow-up for minimum of 42 months and a maximum of 60 months. Additionally, a 30-day follow-up was also done. The secondary renal outcome was a composite of new-onset persistent macroalbuminuria, persistent doubling of the serum creatinine level, end-stage renal disease, or death due to renal disease. Macroalbuminuria is defined as an albumin concentration greater than 300 mg in a 24-hour urine sample, or greater than 300 mg of albumin per gram of creatinine in a first urine sample in the morning. The renal outcome occurred in fewer participants in the liraglutide group than in the placebo group. New onset of persistent macroalbuminuria occurred in fewer participants in the liraglutide group than in the placebo group. The study concluded that liraglutide significantly reduced the progression of diabetic nephropathy when compared to placebo group.